The pain hit Rachel like lightning on a Saturday night. Sharp, brutal, and concentrated in her lower right abdomen. At 43, she'd weathered her share of aches and pains, but this was different. This was the kind of pain that made her consider the one thing she feared most: a trip to the emergency room. Her hospital phobia ran deep, rooted in years of watching her mother waste away from leukemia when Rachel was just 15, followed by countless visits for her daughter's medical issues throughout childhood. She pushed through the weekend, convincing herself it was just a pulled muscle. But Tuesday morning shattered that illusion when she discovered massive purple bruises blooming across her stomach like dark flowers. The fear that gripped her throat was immediate and primal. Something was seriously wrong. After her OB/GYN ruled out IUD complications and her primary care doctor's examination left her wincing in pain, Rachel found herself facing her worst nightmare. Her doctor didn't just suggest the ER. She called ahead, her voice urgent as she spoke to the head nurse about internal bleeding and possible appendicitis. 11:30, Friday morning found Rachel alone in the sterile chaos of the emergency room. Her phone buzzing with work calls her husband couldn't answer because he was busy with his own job. The hours crawled by. Blood draws, CT scans, worried glances from nurses. The diagnosis, when it finally came, was both relief and terror. A hematoma of the rectal sheath, her abdominal wall torn and bleeding internally. Surgery might be necessary. The cause? Unknown, which meant it could happen again. Her husband arrived at 7:30 p.m., not to sit with his frightened wife, but to drop off food. 30 minutes later, he was gone again, leaving Rachel to face the uncertain night alone. She couldn't eat or drink after midnight in case surgery was needed. Her stomach cramped with hunger and fear in equal measure. The next morning brought doctors with cautious optimism, but also specialists that made Rachel's blood run cold. An oncologist, a hematologist. The specter of her mother's cancer loomed as she sat alone, fielding questions about family history and genetic predispositions. Her husband had left before these terrifying consultations, missing the conversations that would haunt her dreams. When he did visit, his anger filled the small room like toxic gas. Not anger at her condition or fear for her well-being, but fury at the doctor who'd asked if her husband had caused her injuries. A standard question in cases of internal bleeding, asked by every staff member she'd encountered. His resentment toward the hospital chaplain's visit, his outrage at insurance charges, his complaints about everything except what mattered most. His wife lying vulnerable and scared in a hospital bed. "I'm not mad at you," he kept saying, but his every word dripped with irritation about inconveniences that paled next to her terror. Rachel found herself comforting him instead of receiving comfort, managing his emotions while her own body betrayed her with mysterious internal bleeding. 4 days. 4 days of uncertainty, of pain, of facing her deepest fears about hospitals and illness. 4 days during which her husband visited 3 times, staying 20 to 30 minutes each visit, missing every important conversation with her medical team. He was off work on weekends, had a retired mother-in-law who adored their 7-year-old son, yet chose to prioritize everything but being present for his wife's crisis. Monday afternoon, Rachel drove herself home from the hospital, her body still tender, her spirit bruised in ways that wouldn't show up on any scan. The house welcomed her with the same indifference her husband had shown. No special dinner, no gentle insistence that she rest, no acknowledgement that she'd just survived a medical emergency that could have required surgery. Her young son hugged her briefly before running off to play. Her husband settled into his video games as if nothing had happened. The dishes still needed washing, dinner still needed cooking. Life demanded to continue as though she hadn't spent 4 days wondering if she was dying. That night, as Rachel lay in her own bed for the first time in days, a terrible clarity settled over her. This wasn't about one hospital stay. This was a preview of her future. With cancer running rampant through both sides of her family, she could see herself clearly. Sitting alone through chemotherapy sessions, facing terminal diagnoses without a hand to hold, dying in a sterile room while her husband found more important things to worry about than his wife's final moments. The marriage vow, in sickness and in health, echoed mockingly in her mind. When sickness had come calling, health had apparently decided to stay home and play video games. What do you think? Was Rachel asking too much, or did her husband fail one of marriage's most basic tests? How would you handle a partner who couldn't prioritize your medical emergency? Share your thoughts and experiences below.